Today we learn something about vitamin B12. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Functions. It is commonly known as cobalamin and is a water-soluble vitamin. It is required for multiple functions in the body. Helps in DNA synthesis, red blood cells, nerves. Besides this, got multiple functions. I am not describing the multiple functions in the detail. Source. It is basically an animal-based food. So, it's common in eggs, fish, meat, and is present in milk and cheese also. It is also available in nutritional supplements. The daily requirement in adults is 2.4 micrograms per day. During the pregnancy, the requirement increases to 2.6 micrograms per day, and during breastfeeding, it goes up to 2.8 micrograms per day. Body cannot store vitamin B12 for a long time. Can store for 2 to 4 years. So if a patient is predominantly vegetarian and doesn't take milk or cheese also, or does not take milk or cheese in adequate amounts, vegetarian people, they are more likely to develop vitamin B12 deficiency and the symptoms. So vitamin B12 deficiency, when the vitamin B12 levels is below 200 picograms per ml or less than 145 picomoles per liter, it is said to be vitamin B12 deficiency. Development. It can be due to inadequate intake, inadequate absorption, decreased utilization, and use of certain drugs. There are various risk factors that are involved. So, atrophic gastritis can cause, post-surgery of the intestines or stomach can cause, pernicious anemia, which is an autoimmune disorder, or if there is intestinal bacterial overgrowth, immune disorders, excessive alcohol intake, and metformin, one of the main medicines that is used for treatment of diabetes, can also cause vitamin B12 deficiency, and proton pump inhibitors. These drugs are usually used for acidity. So regular intake of proton pump inhibitors can cause vitamin D deficiency. In pregnancy and lactation, patients require vitamin B12 supplementation. There are various symptoms which develop gradually. Patient may have fatigue, tiredness, or anemia, or the patient may have palpitations or shortness of breath, pale skin, smooth tongue. Patient may develop constipation, diarrhea, or loss of appetite. Patient may have numbness, tingling, muscle weakness, or balance loss, and patient may also have visual problems. Memory loss and depression can also be seen in prolonged vitamin B12 deficiency. So, how do you diagnose it? In the CBC, the MCV may be increased, and if you do simultaneous vitamin B12 levels, they will be also decreased. Treatment. The consumption of fortified food, nutritional supplements can be given, or you can give oral multivitamins which contain vitamin B12, or you get separate vitamin B12 tablets. Pernicious anemia, patients having pernicious anemia, they were injectables plus minus oral supplements. And there are other methods of treatment of vitamin B12 deficiency also. So coming to the injectables, severe deficiency requires injectables 1 to 4 times per week till blood reports are acceptable. Again, the injectable forms are two: hydroxocobalamin and cyanocobalamin. Mild difference: hydroxocobalamin stays in the body for a bit longer duration than cyanocobalamin. So if the patient stops taking vitamin B12 supplements, then it stays in the body for longer time. Again, daily supplementation, tablets 1000 to 2000 micrograms per day. Nasal gel is also available, but it's costlier. And mecobalamin stays in the body for longer time, and so if a patient takes mecobalamin, then is unlikely to get vitamin B12 deficiency for prolonged times if he stops taking vitamin B12 supplements. Monitoring. Anemia starts to improve in a week or two. MCV starts coming to normal range and vitamin B12 levels start to reach normal. Prevention: eat meat, eggs and seafood, drink low fat milk, consume cheese and or yogurt, may require supplements. Supplements can be in the capsule or nasal spray, fortified foods, avoid proton pump inhibitors or H2 blockers, and if the patient is on tablet metformin, a tablet used for diabetes, then patient will require vitamin B12 supplementation. Complications: patient may land up with various neurological problems or infertility, stomach cancer, neural tube defects, and complications of anemia.